there was a heated discussion on my timeline regarding evidence-based, Panchakarma, whether it is required or not in modern period. So based on my statement, I have given several videos on this before also, but people who are visiting my timeline, recently do not know about this. So they were asking me like, can you establish your statement, etc., etc. So that I thought I will make a video on this. Well, I am Dr. M.A. Krishnan and the pioneer of science-based, evidence-based Ayurveda along with my husband, who is Dr. Rajkumar, and we have been working on evidence-based, emerging evidence-based Ayurveda for the first time in the history of Ayurveda in Ayurvedic perspective. What is this Ayurvedic perspective? What is evidence-based Ayurveda? What is evidence meant to do in Ayurveda practice? There are two kinds of evidences which are required in Ayurvedic practice. Let us start from that point. There are two kinds of evidences. First evidence is for the physician to validate what he is doing, his clinical decisions, how much correct it is, whether it is accurate or not. He should be sure of what he is doing. Otherwise, no use of doing. So there should be, it can be subjective perceptions, right? Unless and until there are standards, objective standards to evaluate the accuracy of clinical decisions, I can feel that what I am doing is correct. Everything is explained in science. All treatments are explained in science. That doesn't mean that if you blindly apply one treatment in a patient and claim that it is mentioned in science, so what I am doing is correct, is rubbish. See, translational medicine research is required. We are learning science, but how to apply the principles which we are learning in the science of Ayurveda effectively on the target in present day morbidities, present day patients, how they are presenting to us. Most of them are having multiple ailments. Most of them are having multiple drugs, multiple treatments. So when they come to us for one problem, how to treat them? There are so many things which are to be appraised in a very systematic manner. So SBBA has first of the time emerged scientific methodology, golden tool of evidence-based practice called as evidence triad approach, a very systematic way of appraisal of the unique internal environment of the patient to understand what is to be applied in this patient to get a sharp diagnosis. It's not that when we see a patient, it's not treatment that has to hit the brain first. The patient has to hit the physician brain first. Patient has to be deeply studied. Yogam ado pariksheda, tado anandaram bheshajam, tada karma bheshak paschat. First of all, patient has to be examined, disease has to be examined in the Ayurvedic perspective, scientific Ayurveda perspective. There it is not ending. Treatment has to be appraised based on the scientific perspective of Ayurveda. Treatment is appraised by the golden standards of tattvas, decision-making principles, which are explained in the science. So there is a standardized clinical decision-making methodology required for the physician to validate whether what they are doing is right or not. It's not subjective perception. It's not many doctors think that my yukti can be different from other yukti. If it is so, Ayurveda would not have stated Shastra Sahita Tarko Sadhananam. What does that mean? That means that reasoning led by inbuilt rational standards of science is the golden tool of clinical decision making in Ayurveda. So it is very clear. It's not subjective. It is
science-based.
Science-based.
Jnana-purvam samacharita.
Right. Jnana-purva karma. So conscientious means physician should be very much clear of what he is doing. He should be diligent. He should be careful in what he is doing. It should be ethical. Something mentioned in science, not blindly applying in the patient. That is called conscientious. Explicit means what? Transparent. It should be not hidden. What you are doing, you should be able to explain. You should be able to predict. There should be transparency. And other doctors should be able to apply the same logic in identical situation and yield the intended effects. It is not a benefit-risk ratio. Ayurveda doctors, please understand this seriously. I am getting lot of benefits with Vamana Karma. No validation at all. Every karma will yield some benefits here. That doesn't mean anything. What is intended to be checked is Samyak Prayogam Sarvesham Siddhir Apnodi Karmanam. Intended effects. What is the intended effects?
Thadu Samya Kriyacha Utta
Tandrasyasya
Prayojanam. So only objective is to produce health.
Healing and health.
Healing means reversing the cause mechanisms and produce health.
Yeah.
Sada dosha ushadhadini vikshya dvadasha tattvadaha. So you have to examine so many factors. And kutya chigilsidam pratnyo na yogaireva kevalam. Not with some formulations or some procedures. So it has to be examined in so many ways. You have to apply your logic, scientific logics, and determine a treatment principle. And according to the patient's status, disease status, we have to determine how it has to be employed in the patient and to achieve thadu samyam, or to reverse the disease mechanisms and reinstate thadu samyam. So that is the objective, and it is not based on beliefs, it's not based on experiences.
So Ayurveda doctors are telling it is tradition based practice. Ayurveda is how stupid. Tradition means blind intuitions, beliefs carried over for generations. If it is tradition, then why to go to Ayurveda college and learn a science? You only need to follow your forefathers. You can ask them what they were doing. That's what is happening today. So it is not tradition. Tradition means what they are justifying. How they are justifying is, we have been doing this always. Who are you to question us? We have been doing this always. Who are you?
Logically.
Are you new generation Charaga? I received a question today. Are you new generation Charaga? We have been doing this only, and we will do this only. We won't think again. That is what they mean, many of them. So that is called tradition-oriented practice. That is wrong. In a science, tradition-oriented practice is wrong.
110% wrong.
Convention-oriented practice. Tradition means for generations. Convention means all of us are doing. All of us are doing this. We are getting benefits. That's what I told. Benefits are not countable in Ayurvedic science. In Ayurvedic science, intended effect with cause, mechanism, effect relationship. Intended effect in intended time is what matters. It's not benefit risk ratio. We are not practicing a probabilistic medicine. Our treatment is not starting from an unknown compound or intervention. Our treatment is not starting like that. Ayurveda is science-based medicine, and the science is explaining logics, algorithms, theorems. We don't have theories. We have siddhantas. Parikshagir bahuvidam parikshya. Hedubir sadhayitva. Stapyade nirnayaha. Established theorems are there in Ayurvedic science. Panchamahabhuta siddhanta, Tridosha siddhanta, many siddhantas are there. So we have to practice science-based medicine. And also everything explained in science does not mean we can choose from science and apply. Translational research is required. In the unique environment of patient, how to apply these tattvas to examine and to understand, to arrive at a rational diagnosis of the patient and the disease and the unique internal environment of the patient. Every physician should identify, every physician should arrive at a uniform diagnosis in the identical conditions. It's not that 100 physicians making 1000 variable opinion based diagnosis and telling that it is the beauty of Ayurveda. That is how they justify. Anybody can diagnose anything. That is the beauty. That is not beauty of Ayurveda. You are insulting Ayurvedic science. When you say that, Ayurveda says Shastra Sahita Tarko Sadhananam. Science-led reasoning, Ayurvedic science-led reasoning is considered as the golden tool of standardized decision making. So in SBEBA, we have emerged.
And also one point is, Acharyas only told that if you are just following science and not the Shastra Arthas, practical aspects or intentions of Shastra.
Shastra Arthas, can you explain?
Those Shastra Arthas are objectives, how to understand in the practical way, in the present day.
Principles, right?
Principles. So, without that, if somebody is practicing, they should be abandoned from a distance because they are like rope of Yamadeva. They can kill you from a distance. One procedure for all diseases or one procedure for one disease, if everything is fixed in advance. So that can result in fatality also. That is what Acharyas say. It is not new
not our opinion.
Yeah.
It is so ancient scientists were that much emphasizing to practice rational science-based medicine, Ayurvedic science-based medicine. Because of this reason, we have started our basic and applied research right from 2010, seriously, and we have emerged certain standards, inbuilt diagnostic, prognostic and treatment standards. We have emerged a methodology called evidence triad approach to apply in the unique internal environment of every patient to verify step by step diagnosis, treatment, whether what we are doing is right or not, to compare with the innate rational standards given in the science. So it is not direct application of science. At the same time, it is not negligence of science. In the unique internal environment of current era patient, how to understand a disease. Very important. This is not taught in any Ayurveda colleges.
Because of this flowed education in BAMS, these practical aspects are not known. They are learning like literature,
right,
and whatever their seniors or physicians, teachers are doing, they will be blindly following that, and that will be passing on from one generation to next generation. This is what is happening. That is why if they are certified doctor also, BMS graduate also, what they are doing need not be correct, because they are never correct, because nowadays the teaching methodology, means teaching in academics, is of very substandard, and there is no standardized way of teaching even.
Shastrarthas are not known, no.
No, means
definitions.
Each teacher will be teaching in different ways.
Different ways.
So there are no standardized knowledge,
comprehension, standardized comprehension, and standardized translation into clinical practice. When a faculty is doing viva or bedside exam, whether the faculty has got some rational standards to verify whether what the student is telling is correct or not, it is based on his subjective perception that he is judging the students. Just imagine, after this many years of education also, there are no comprehensive standards, there are no uniform standards for clinical decision making. Are we depending on the search engines in the laptop to decide what is good for the patient? Are we going to search PubMed and other websites to understand what is good for the patient? In modern medicine, they are doing that. They don't have any other way. For them, that is the evidence, research evidence. Why we are meant to do the same thing? Our nature of science is different. Our comprehension of science, we have a determinist science which advocates deductive reasoning, individualized, unique internal environment of patient, every patient. Patient is not population. We get benefit risk ratio. What is the advantage? For what we are doing this stupid thing called research, by mimicking modern medicine, biostatistical research. What is intended to do? Finally, they want that evidence to confirm what they are doing in the patient is justifiable. Are we depending on that? Is anyone who is watching this depending on PubMed and other search engines to decide what is good for your patient or what is intended for your patient? No. Then why you are doing this silly, stupid kind of research in MD and PhD? Why people are not opposing this? For years this is being continued, and when we talk about a treatment, whenever a patient comes, treatment is what is hitting their mind.
First, which medicine is applicable to him?
Which treatment
procedure is applicable to him?
Not the patient.
Which all procedures can be implemented in this patient.
Right.
So it's from the treatment perspective or the medicine perspective, procedure perspective, they are seeing the patient. Actually, in Shastra it is mentioned that Darsanadhyay Avahida. First, we need to examine, and Tat Samyak Upalakshayet. We need to understand from the science that what what might be the cause behind this. And with principles, we need to understand by Anumana, we need to understand the cause mechanism behind that. And with Yukti, Buddhipashyati Abhavan, Bahu Karana Yogajan.
Multiple factors.
Multiple factors are integrated, and we need to determine the treatment principle, which is by Yukti, and then assess so many other factors, the patient status and disease status,
and
strength of the patient, strength of the disease, everything, then how it can be applied.
In the unique internal environment.
Environment.
Of
it's
the
not
particular patient.
like once you see the patient and then you can directly go for some medicine or procedures.
Online also prescriptions are going on a lot.
Yeah. And pradikshanam samyak means you need to assess the patient every muhurta, every 48 minutes we have to assess the patient also. So such fast response will also develop with Ayurvedic treatment. So without checking any of these things, the practice is going on, and
for this many years, that's the
a BMS degree holder doesn't mean that whatever he is doing is scientific treatment, because the education system is so much flawed.
It's very unfortunate that education system is very flawed. So we have developed a technique called evidence triad approach, where all the physicians who are learning SBBA can uniformly practice clinical decision making methodologies, tools and methodologies to understand science and to apply science in the unique internal environment of the patient, something which is not taught in any of the Ayurveda medical institutes till this moment. And also many things are comprehension is wrong in colleges, right?
In colleges, all Ayurvedic institutions, there is one precedence that if a Panchakarma patient, a paralysis patient comes, first they will be doing Udvartana with some powder, then Pilichil Kiri means oil application followed by giving pseudorification, like making the patient sweat, Swedana. Then Basti, a set of Basti. So these all are prefixed or scheduled in advance itself. Whatever the status of the patient, irrespective of the strength of the patient, all these procedures will be given. That this treatment to be given in this patient. Or a psoriatic patient comes, initially this has to be done, Vamana has to be done, Takratara has to be done. Or if a patient with low backache comes, he has to be given purgation with castor oil or medicated castor oil, or Basti will be given, or Kadi Basti oil application. So all these are fixed in advance. So such procedure, such practice is going on in all Ayurvedic institutions. Nowhere it is taught that how to examine the patient, how to examine the strength of the patient, how to examine the state and stage of the patient, how to examine the disease, how to identify the stage and strength of the disease, how to determine treatment principle. So nothing is taught directly for this patient, this procedure, these medicines, these things are to be checked, and every year or every 3 months the same procedures are to be followed, or medicines are to be continued for these 3 months, 6 months, like
and
that.
This Panchakarma also, I have been listening to a Panchakarma faculty in a YouTube video. She was telling that metabolic ailments are there, so Panchakarma will stabilize metabolism. According to her, Panchakarma will stabilize metabolism. That is one thing. And also it will remove the toxins from the body. Nowadays the environment has lot of toxins. We are ingesting lot of toxins through food, the medication, etc. So Panchakarma will always detoxify the body. This is one thing. Second thing, the funniest thing and the cruel most thing, one side all the drugs will be administered, anti-BP drugs, and I have checked this with Panchakarma departments of many colleges. From one side some Western drugs,
they will not be stopping all those.
Anti-BP, anti-diabetic.
Thyroid.
Along with that, pre-karmas and karmas, Panchakarma, etc. will be, patient will be undergoing multiple procedures, internal Ayurveda medicines. We know how many internal Ayurveda medicines are given in the prescriptions today. public will be knowing what I am speaking. One person came to you with carrying a big shopper, no?
Yeah.
Thinking that Ayurveda clinic will have this many medicines. So this is how people, public think. Why this many medicines? Why this many medicines? Ayurveda is science-based medicine. Na yoge reva kevalam. Ayurveda advocates not to treat by medicine, but to treat by science. If you know science, if you know how to apply science rationally in the patient, one principle can be implemented with one medicine. You cannot apply multiple principles in a patient. You have to integrate multiple pathologies with one or two diagnostic principles and implement it with one treatment principle. That is called scientific decision making. If you are implementing one treatment principle, why do you need more than two medicines? 5 and 6 and 16 and 20 medicines.
Prove this, we need not do in hundreds of patients. If we need to make cure or address the cause mechanism in a patient and show how he is attaining health.
Reversing disease.
For that, benefit risk analysis need not be done. Means if a procedure is done, there will be some effect. There will be some risks also, but not on the cause mechanism. But it will be affecting the. He is getting good result. One symptom suppression or one lab value getting changed is not the result what is intended. Intended result is reversal of cause mechanism and making the patient to a healthy status.
And it should happen hour by hour, day by day.
So this need not be proven with statistics, benefit risk analysis by suppressing such symptoms or getting some results in some symptoms.
And how can they say that the result is because of this Panchakarma?
Because they
are not stopping any BP drugs. How can they say that patient is safe? Is there any safety studies going on?
And that study itself is highly wrong because it's based on one procedure. The patient is assessed. The disease is assessed. So that is 110% wrong.
How unfortunate and pathetic it is. Distorting a science to maximum. Mixing up several medicines, treatments from different systems and administering. One of my friends told me that even the faculty doesn't know that or just blindly admit the other drugs which the patient is taking side by side. Just ignore. Now do this Panchakarma or Virechana. Patient is on multiple other drugs. Nobody analyzes anything.
They are not even caring.
I'm not telling about students, I meant faculties who are doing this. So
they just
how
wanted
unfortunate.
To administer so many procedures.
So I have some questions which are very straight. Why Panchakarma is not required today to maintain health or to detoxify body? Ayurveda recommends to practice Nehasveda, Shodhana. This is what people believe and Ayurveda doctors propagate. And before starting that question, let me ask you, do you think any difference in the internal environment and morphology of the human being has happened over this period? In the present scenario, when you compare human beings functionally with the people who were living 5,000 years before, when Ayurveda emerged, do you think though the human beings are identical by all means in their immune status, digestion, metabolism?
Their strength, their so many factors are mentioned, like their strength of at the time of birth itself, what the status of their homeostatic mechanism, how their tissues are or stem cells, how excellent they are, or from the resistance, immune strength. So from that point, when we analyze, in olden times, that much strength was there in the subjects, and they were able to tolerate so many things. They were
hardworking, right?
Hardworking.
Physique was good.
Their physique was good. Their ahara shakti was good. Vyayama shakti is excellent, and they were having good immune and resistance. And if at all they develop some sort of dysfunction, it gets automatically correct by their activities, by their exposure to sun and breeze, and they will be working in fields. So their strength, when we check, when we analyze the Shastra, that those who are having pravara bala or very good strength can be given this Shodhana Chikitsa, and those who are not having. But nowadays we can't see even a patient with that much strength. Plus, after the advent of Western medical system, so many new diseases have emerged. The mechanisms have changed.
Altered.
Their lifestyle has changed. Their food and regimen,
Nutrition.
everything has changed. So, new diseases have emerged. So, new type of disease manifestation developed. In olden times, Arbuda is explained as one excess usage of some herbs or some specific kind of things. But nowadays it's not happening like that. It is by altered immune status, and because of that altered immunity, the nature of the cells are getting changed. So the cause has changed, the mechanism has changed. Nowadays the diseases which are manifesting are most acute diseases are infections and inflammations. So for infections and inflammations, we need to address the basic metabolic defect with which the immune dysfunction has happened. So when we address the metabolism, it automatically kindles the immune activities, and that infection will be subsided, or that pathogen will be destroyed in the body, and automatically it comes to a normal state. So there is no need of any
Panchakarma
procedures to reverse that pathology. And inflammations are of immune response against any harmful agent in the body. So if the body identifies a harmful factor in the body, immediately immune response happens. So that correction of that immune response or kindling the immune activity by modifying the metabolism and other mechanisms, we can correct this inflammation, whatever be the inflammation, whether it is autoimmune or by infection or other ways. If inflammation is developed, we can reverse that. If there is hormonal imbalance, so what we need to do is not removing something from the body. So we need to normalize the hormonal activities. For that, there are specific methods mentioned in the science, which we need to implement according to the patient status. Also, in PCOS, polycystic
metabolic imbalance.
It is metabolic imbalance. So hormonal imbalance is there.
Immune dysfunction, immune-mediated diseases.
It is managed with Vamana-karma, Vasti-karma.
PCOS is managed with multiple therapies in the
So what is
hospitals.
there to be expelled? There should be something to be expelled. Diseases happen when homeostatic mechanisms are overcome by a factor. When that factor is called intrinsic causative factor. When this intrinsic factor, according to its strength and nature, it will be affecting certain tissue functions, and in a system it will be producing a dysfunction. So a systemic disease manifests. So this internal cause, after producing a set of changes, set of mechanisms take place, and a disease manifests. And this intrinsic cause is to be addressed before addressing the disease. When a disease is, when the patient reveals the disease itself, people will be thinking of what procedure has to be done. But it is not like that. The intrinsic causative factor is to be addressed. And this Shodhana Chikitsa is intended, this Panchakarma procedures, for expelling the intrinsic causative factor. That is intended only in certain circumstances. Like this intrinsic causative factor will be producing certain clinical features along with the disease. Disease symptoms will be severe, it will be chronic, it can be having more serious symptoms also. That doesn't mean that this Shodhana Chikitsa is to be done. Along with the disease symptoms, whether it is severe or mild, if these clinical features of intrinsic causative factor develops only, you need to do this Shodhana Chikitsa. But nowadays, the diseases are of different nature. Either immune dysfunction, either altered metabolism, so diabetes, altered circulation, altered drainage mechanisms. So the intrinsic causative factor is altering the immune system. So we need to correct the immune mechanisms. So it's not like immune system can be expelled from the body. You cannot do Shodhana Chikitsa in such circumstances.
No, what they say is toxins are removed.
Toxins when get accumulated, toxins are not the culprits. Body's response against that toxin is to be addressed.
That is the point.
There will be immune dysfunction. So that immune dysfunction has to be corrected. So normal immunity will neutralize this toxin.
Yeah.
It is not like toxin can be removed by this Shodhana Chikitsa. Shodhana Chikitsa is Edireyet Behir Doshan.
Panchadosha.
So it is not toxins that are removed, only doshas are removed by Shodhana Chikitsa. So detoxification is done with Shodhana Chikitsa is 110% wrong. It is cheating the people, cheating the public.
People think that COVID vaccine effect can be
COVID vaccine
removed by...
So this toxic effects of vaccine or whatever it is, it can be by unwholesome food and regimen. Toxins that are developing, it will be producing a response in the body. How the response is, based on that, we need to modify the treatment. It's not like a toxin has entered, we can detoxify by doing these procedures. That is misinformation, that is misleading, and that is cheating also.
So all this faulty knowledge is happening, in my understanding, it is happening because nobody is teaching regarding what is infection, how in Ayurvedic perspective, how to diagnose an infection based on its nature. There can be different kinds of infections. Pneumonia is different from urinary infection, which is different from hepatitis.
That was evident during COVID period. They were identifying it as Tridoshaja, Bhudocha,
my God, Krimi, Tridoshaja.
So whatever comes in mind, they will be telling, and it will be approved by authorities also.
Yeah. So this basic level of comprehension, how to understand a modern age disease led by scientific principles of Ayurveda. What is inflammation? People, Ayurveda doctors will say Pitta. It is not Pitta. So inflammation is not Pitta. So this kind of basic... They don't know
Pitta as well as inflammation.
So this, what is hormonal dysfunction? How do you understand a thyroid, hypothyroid, autoimmune hypothyroid in scientific Ayurvedic perspective? I'm not blaming my friends, Ayurveda doctors. What I mean to say is that deeply flawed Ayurvedic education is going on for at least more than 50 years. And that is why scientific perspective of diagnosis of modern age ailments is not happening. What is hypertension? What is type 2 diabetes in accordance to the people who are reaching us now? Diabetes patients will be having hypertension, hypothyroid. They will be having cellulitis also sometimes. How do you manage such a condition? They are approaching you for cellulitis or arthritis. For example, arthritis. How do you manage arthritis? You will mention some kashayas for arthritis. You will mention perhaps one medicine for diabetes. Along with that, you will ask patient to continue whatever medications they are doing. Because you are not confident in your diagnosis. See, there is no disease-oriented diagnosis in Ayurveda. There is only patient-oriented diagnosis. You have to integrate multiple live pathologies in the patient. You have to apply a diagnostic principle and you have to reverse it by a treatment principle where that will work in multiple targets in the body, simultaneously healing. When you are treating for cellulitis or arthritis, diabetes will also simultaneously improve because you are focusing on metabolism. So this kind of subtle most approach, this is what is called scientific Ayurveda. When you are giving one medicine for one disease, for 5 to 10 medicines for different disease and asking suppressants to be continued. Where is science and where is Ayurveda? So the basic mechanism is not correct, and also modern medicine continuing with what you are prescribing. There is no evidence of scientificity in your prescription. You are allowing some medications to be continued. You are not ready to take responsibility of the patient to heal the patient. Modern medicine, their means is to continue prescription lifelong. Is it what Ayurveda says? Tadhaiva yuktam vaishajyam yad arogyaya kalpade sajaiva bishajam shreshto rogebhyo ya pramojayet. Our responsibility is not same as Western medicine physician. What is our responsibility? Rogebhyo ya pramojayet. You have to work to release the patient from the clutches of disease and need of treatment, which means you have to integrate, you have to probe into the patient scientifically, you have to simultaneously work on multiple targets and heal the patient in a very fixed time. You should be able to convey what you are doing in the patient, you should be able to demonstrate, you should be evaluating patient day by day, make sure that you are doing the fair means with the most minimum medication. Why Panchakarma is required? Why to start thinking from Panchakarma? Maybe you are a lover of Panchakarma. You study why Panchakarma is not required. You know, present day diseases, present day patients. Some students ask me.
In olden times also, Acharyas clearly mentioned Viparita Gunair, Desha Matra Kalopa Padidam, Peshajer Vinivartande Vikara Sathya Sammada. All the Sathya diseases, all the diseases according to Ayurvedic science, which all are curative or which could be cured with Viparita Guna Peshaja. Viparita Gunair Desha Matra Kalopa Padide. It's not simply administering Viparita Guna medicine. You should examine the patient status, disease status, etc. Desha Matra Kalopa Padidam and Peshajer Vinivartande Vikara Sathya Sammada. So all diseases could be cured. And also Kramena Apachida Dosha, Kramena Upachida Guna, Sando Yanti Apunar Bhavam. The diseases which have regressed with this means you are removing all the causative factors and you are making the patient healthy and improving the health. Then Sando Yanti Apunar Bhavam.
It will not reoccur.
That disease will not recur.
If it recurs also, we can...
Sandoyanti Apunar Bhavam Bhavanti Apragambhyacha. And that health status will be the most stable one.
Yeah.
So when the digestion and metabolism are perfect and it's very much kindled, that is the purest form of the body. It is not by making the patient lose motion 5-10 times or by making him vomit. You will not make the subject healthy and pure. Pure means when digestion and metabolism is highly active. Visrishte Vinmutre Hridi Suvi Male Doshe Sopathage Vishuddhe Cha Udgaro Shutubagamane Vade Anusaradi Vishadagarane Dehe Cha Sulakau. So Vishadagarane means all channels are clear. Dehe Cha Sulakau.
Excellent metabolism, right?
Excellent metabolism and feeling of lightness, and that is the most pure status of the body.
So that also indicates hormonal balance.
Yeah.
That indicates excellent internal drainage mechanisms, processes like apoptosis, all these things. Everything, immune activities, everything. So this is the objective of Ayurvedic, scientific Ayurvedic
when
treatment.
Unnecessary this Panchakarmas are done, this karmas are done, that will definitely alter the homeostatic mechanisms.
Right.
So body is trying its best to stabilize the internal homeostasis. So it has got so many mechanisms. It has got intricate, complicated, intrinsic mechanisms with which it is maintaining the internal environment in a definite range, in a limit. So when this Panchakarma is administered in a disease status, when already the homeostatic mechanisms are altered and so many Western drugs are taken to suppress them, when this Panchakarma is also administered, it will permanently disrupt the homeostatic mechanism. And the result you get with that is very much temporary and transient. So it will never going to make the patient healthy. So already disturbed homeostasis, you are disrupting it completely, and the patient can develop any sort of complication,
dysfunction, hormonal dysfunction, metabolic imbalance,
and even fatality can happen.
Immune dysfunction. Is there any study going on what is happening to those patients? Now in the timeline, my timeline itself, two patients
in
wrote their
autoimmune
experiences.
conditions like arthritis, they are doing so many Panchakarmas, including Basti, and Panchakarmas are being done.
It is mentioned in the science, they are telling.
Yeah.
Virechana is mentioned in Amavada. So why can't we do Virechana? Does it mean that we have to apply everything blindly in all patients?
Kathanjana prayunjida. It should not be applied at any cost. That is what is mentioned in science. It is not like general principles are there, but specifically in such conditions, na kathanjana prayunjida. It should not be applied at any cost. That is what is mentioned. Then also in all institutions, rheumatoid arthritis or whatever the autoimmune condition is, psoriasis, all these procedures are done always applying sneha oil application. Pseudorific methods are done.
Right. So when a wrong treatment is applied, it is causing lot of adverse conditions in that subject. See, when we are not sharp in understanding the patient unique internal environment, we are not applying the right diagnostic principle, right treatment principle in accordance to the state and stage of the patient and the disease. What happens? Every step that we make with regard to diet, medicine, process, whatever it is, it's going to adversely impact. Now many people think that Panchakarma, if being done rationally, it makes a difference. It will not make a difference. Why Panchakarma is not required today? Already he has explained the internal environment of present day human being is of such a kind which is highly adulterated. Immune status is altered, metabolic status is altered, digestion is very poor, multiple ailments are there which are unresolved for such a long period.
On suppressants.
And on suppressed, that is what I mean. And not only unresolved but also suppressed, and that suppression for long period has resulted in so much of compromising factors in the body which are also adverse. So in such a state, that explains well-defined contraindicated status for Panchakarma. There is no indication for Panchakarma in such a state. Then where is the question of analyzing for contraindication? When we are treating a patient, we should start thinking from the patient, not from the perspective of a treatment. I am going to give this kashaya in this patient. When you find a rheumatoid arthritis, wow, my faculty taught me this yoga. I am going to prescribe, copy this. It is foolish. You have to explore your every patient. Every patient is different. My patient is different from your patient. When you sit with me, you won't be able to study what to do. For that, you have to study SBEBA, science-based, evidence-based Ayurveda, decision-making principles. What we have never studied in colleges, we were getting so much sad, so much depressed, even an acute condition, we haven't seen. I haven't seen any faculty curing an acute condition fast and transparent and explaining what he's doing.
You have seen
I don't know, I don't have any lack of obligation. I am obliged to those people who have guided me in my life. Don't consider me as arrogant or proud. I am telling truth only. I am never motivated by anything in my Ayurveda college. I also studied in a very good, I was a merit student, but I didn't see, what I found was multiple yogas being prescribed in prescription endlessly. When a BP patient comes, 3 kashayas, Ashtavargam, Gandharvahastadi. Being an internee, I have to copy what my faculties are doing. When I ask question, they will give blind answers. No specificity, no clarity, nothing. Is this what Ayurveda is meant to be practiced for all these years? And nobody has any problem at all. When there is no wonder that Ayurveda is not getting globally recognized as a medical science. When we are treating acute conditions fast, in SBBA we are doing SBBA physicians might be watching, trained practitioners are watching this program, I'm sure. You can ask them also. This is not two people emerged this, that is true, but many physicians are practicing this. We have trained right from 2015. We have been training very systematically many students and doctors of all age groups and experience. Experience doesn't count. Experience of science-based, evidence-based Ayurveda only counts. Applies to me also. Okay.
So Panchakarma is unintended based on two things. One, the modern day diseases are of either metabolic defect
or immune.
Metabolic errors or immune altered immune mechanisms and improper circulation, improper nourishment, improper food habits and lifestyle have created altered mechanisms. For altered mechanisms, we need to correct the mechanism. It is not like to remove something from the body and we will be able to correct that. And second one is what is mentioned in Shastra itself, that there are certain clinical features with which we can identify that the causative factor is in excess amount. If those clinical features are not found along with the disease symptoms, it's not like it's a chronic disease. Or in
that's
this
what is believed. Chronic
it's
disease.
Very chronic disease.
Deep-seated disease.
Deep-seated disease. Or in this season, we need to do this.
Panchakarma. Ritu Shodhana. It is mentioned in science. So we have to do.
It's not like that. So it should be based on that clinical features which are determinant of how much quantity doshas, how much
it's
amount.
not only regarding excess dosha, it is also regarding the entire internal environment of the subject. Entire internal environment of subjects, more than 99% of all kinds of patients today are absolutely contraindicated for any of the Panchakarma procedures. And when you are doing Purva Karma like oiling, Abhyanga or Sweda, Snigdha Sweda, when you are doing in contraindicated status, even from the first day of Purva Karma itself, their existing diseases will start worsening. If their metabolic status is poor, if they have...
Asathyada. It can become Krichra Satya or Asatya. That is what is mentioned in science. This is not, we both are saying. This is said in science itself.
So, this is what the problem is. And polytherapy, how can we establish that Panchakarma is unintended and complications are happening by unintended Panchakarma? For that, first of all, you should start evaluating a patient in his unique internal environment in the systematic way of SBEBA. If we do not know how to estimate a patient environment, how can we understand whether something is correct or not? How can we understand? How can we verify what we are doing is correct or not? For that, there should be standardized methodologies based on the science of Ayurveda, which are to be applied sensibly, systematically to evaluate step by step, each and every step. We have developed a method, VBPT, and we have also developed evidence triad approach for standardized clinical decisions.
When science is not followed, it is unintended only. And what all are developing, all these are complications of this unintended procedures.
So, and
that is very clear when you know the science.
So that is why I ask many of the PG scholars of Panchakarma to study the contraindications and complications of Panchakarma. When you are doing Panchakarma without any sense or without any appraisal of anything, any disease, this disease, that karma, what will happen?
We can identify the complications.
Even we have to study how to avoid. I mean, there is nothing to study how to avoid because there is no necessity of Panchakarma. That is how the patient environment is today. And polytherapy is a serious problem in Ayurveda. Multiple kinds of medications and treatments are rendered on the same day with and without modern medicine. I don't know where this is going to end. It's a very serious, fatal effects can happen sooner or later in the patients. Years before, I used to tell, don't prescribe medicines in newspaper. Once I happened to see medicines described in Karkadaga Ritu in newspaper, Madhrumi newspaper. So I wrote on Facebook, please don't prescribe medicines in this medicine in that disease. That time many of the Ayurveda doctors started shouting at me. Who are you to say that Dashmula Risham is safe, this one is safe, that one is safe? Is it fair practice to prescribe medicine like in all these diseases you can take Dashmula Rishta, these diseases Vindhyadi Gudika, in a newspaper for laymen? How much unscientific it is. In the same way, with the same honesty and purity in my intention, we have done this video to say that it is not required. Panchakarma procedures are not required in the present scenario. And also,
no clinical audit.
There is no clinical audit in Ayurveda today. There is no clinical audit, which means anybody can prescribe, anybody can diagnose, any patient as anything and do anything based on his self-experience or shared experience or intuition or tradition or belief. He can decide anything. When patient asks question, he will say, it is because you haven't responded to internal medicine, Panchakarma is required. And they will be admitted prefixed packages, and if not responding, again will get, you should admit again and again. See, I have seen one patient, his wife, he wants to show me, he was telling me 40 years she was getting treated by a reputed Ayurveda hospital for her rheumatoid arthritis. Can you believe 40?
Yeah.
40 years. And she has deformities. And he is asking me whether it is possible to cure the deformities with SBABA. So just this is the reality what I told. It's very pathetic. So our humble request to policymakers, please, we have already submitted science-based, evidence-based Ayurveda proposals. Please consider them and call us for a symposium. We can explain, we can lively demonstrate in patients, and you can also analyze the results. It is not something which is confined to theory or textbook. We are regularly doing this for the past 2 decades. There is transparency and reproducibility, the hallmark of scientificity. In what we are doing, there is a standardized methodology for objective evaluation of clinical decision making.
It can be taught, it can be learned, it can be reproduced. There is transparency.
It can be researched. And what is the purpose of research? Let's come back to that point. Research in Ayurveda is to improve the accuracy in clinical decisions, to save the patient, to protect the patient, to do what is intended in the patient to reverse the disease, hour by hour, day by day. When we start doing this in SBABA, we are doing this. Patients are getting surprised because they are on 16 medicines when they approach us, or 20 medicines. We are educating the patient, stopping these medicines from day one with the consent of the patient. Hour by hour, first 3 days are very crucial. We are evaluating patient status, making sure patient is getting stabilized, improving without any suppressants, with minimal fragmented dosages of Ayurvedic classical medicines. No divine medicines. Minimal 1 or 2 Ayurvedic classical medicines we are depending on with principle-oriented approach. So this is possible. So last but not the least, why and how SBABA is scientific. There is a reference in Charaka, Yasya Anyobi Vedarthat Aviparidaha Parikshagir Pranida Shishta Anumada Loganugraha Pravartaha Agamaha. Anything which is scientific in Ayurveda is decided by these parameters. Yacha Anyobi Kashid Vedarthat Aviparida. It is
objective.
not contradictory to the objectives of scientific verses explained in the science. In Ayurveda, there is basic research and applied research in Samhitas. So what is explained as the outcome of this research? Not contradictory to that. Parikshagir Pranida. It is well researched, accurately researched in Ayurvedic methodologies. Ayurveda research methodologies are entirely different and led by deductive reasoning, unlike probability-led, unknown compound-led research based on inductive reasoning in modern medicine. So Parikshagir Pranita means experimented by Ayurvedic research methodologies. Shishta Anumadaha, reproducibility. Those logics which are verified and approved are being repeated by other physicians, and they have also yielded intended effects which are explainable by identical cause mechanism effect relationship. That is called Shishta Anumadaha.
They also agree with this.
So they agree with this methodology. It's not Remya's Ayurveda or Rajkumar's Ayurveda. It is science-based methodologies, decision-making methodologies which are pinpointed. Shishta Anumadaha Loga Anugraha Pravurtaha. Ultimately, it's not benefit risk. It's not trial and error. It is for healing evidences. What are the two kinds of evidences required in Ayurveda? Number one, primary evidence for the physician to verify and confirm what he is doing is right or wrong. Scientifically. Scientifically means as per the rational standards of science. Number two, evidence of healing in every individual patient. Evidence of healing. I repeat, healing. Healing. Reversal of cause mechanisms of the disease is called as healing.
Health.
So whether what you are doing is facilitating healing or not, you should be able to show, demonstrate. That is the evidence of healing, not benefit risk, which is the secondary evidence of Ayurveda.
That is what Loga Anugraha Pravarta.
That is ultimately intended for universal well-being. So with this, by conveying this message,
Samyak Prayogam
Sarvesham
Siddhi Rakyadi. So Siddhi is accomplishment of the objective of cause mechanism reversal.
Yes.
So that is what is considered as Siddhi, and it is by Samyak Prayogam.
Optimized.
So whether it is mentioned in text or not, how you are applying is very important.
Yes.
After assessment, you are determining a treatment principle and how you are applying. Samyak Prayogam, Deshamatra Kalopapadidam, Purusham Vikshya, Satnyayo Pishag Uttamaha. So, Smrdiman Hedu Yuktitnyo Jitatma Pratipattiman, Pishag Aushada Samyoges Chigilsam Kartum Arhadi. So, everything is based on the knowledge-based application. Jnana Purva Karma is very, very, very important, and without that, whatever result you get with Panchakarma or something else, that is Yadricha Siddhireva.
Vina Tarkena Ya Siddhi, Yadricha Siddhirevacha. So without any, you cannot apply Shastra Sahida Tarka in such results. So it is Yadricha Siddhi, spontaneous results, which are invalid. Accidental results, which are invalid in Ayurveda.
Yeah.
And last but not the least, before winding up, I want to clarify very straight that this video was not done for an advertisement purpose. This video was to honestly expose the science of Ayurveda as it is with the methodology that we have emerged in science-based, evidence-based Ayurveda. Second point, this video is not at all an attempt to demean or ridicule any Ayurveda doctors or institutions or organizations or individuals. Rather, this video is straight exposition of what is intended to be done in Ayurvedic scenario, current Ayurvedic scenario, which is in a very pathetic scenario. There is no clinical audit, nothing. So there a change should emerge which can contribute to national economy. Man days will improve, healing period will reduce, people will start getting well with minimum medications. So what you call national economy will improve, and other countries people will look into India, what is happening to people here. They are recovering so fast with Ayurveda. So we should also have Ayurveda medical colleges. We should be knowing what is their evidence-based medicine. Now what we are doing is just opposite to what we are intended to do. So to convey that message, I cannot agree with you and stay with you. We have to justify what we are doing and how it is ultimately intended to save Ayurvedic professional community and to save the integrity, identity and independence of the medical system of Ayurveda. Jai Hind.